Hello, Green Team. Happy Monday. I hope everybody's enjoyed their Memorial Day. It's a bit of a casual video update today. It's been a while since I've done one, and I may have lost my voice a little bit. I've been all weekend at a big pool party with several thousand of my closest friends at the Lake of the Ozarks this weekend, so still recovering from that. But seriously, hope everybody's had a great weekend, and thank you to those of us who have been working this weekend to take care of our patients so that the rest of us could enjoy our Memorial Day weekend. It's been a while since I've done an update, so I just thought I'd address some of the questions that have come in and just some of the new things that have come up as far as the COVID-19 pandemic and answer some of those questions. So obviously, speaking of the Lake of the Ozarks and pool parties, things have opened up a fair amount here over the last week or two. In different phases of those opening up of different communities. Restaurants are starting to open up as well. And so the question is, what does that mean? What does that mean for the virus? What does that mean for cases? And unfortunately, we still don't know exactly what that means. Hopefully, with still having precautions in place, if people are smart and we open up slowly, we won't have a huge resurgence, but time will tell. One of a few things will happen. We'll either still see either a flattening of cases or possibly a drop in cases. Sometimes with the influenza epidemics or pandemics, you'll initially see a sharp drop in cases, and then unfortunately you might see another spike in cases after that drop. That's one possibility. We will see more cases eventually. It's just whether those happen over the next few weeks or few months, it's hard to say. Like I heard one epidemiologist describe it, he said we're still in the second inning of a 9-inning ball game, and so we're still not through this, even though things are open up. I'm hopeful that if we do that slowly and cautiously, that we won't have a huge resurgence of cases. It still is a good idea to socially distance. Still is a good idea to not congregate in large groups. It still is a good idea to wear a mask when you're out in public. No, it does not prevent the spread of the virus, and no, it does not keep you from getting the virus. It helps reduce your chances, but it only does that if everybody does it properly and effectively. So I still encourage that. Unfortunately, it's certainly been a polarizing issue lately, and from one end of the spectrum, people saying that you're a bad person if you're not wearing a mask, all the way to the others who are saying that nobody should be wearing masks. And unfortunately, very, very polarizing. Like a lot of things, the truth is in the middle. It can help reduce the risk for certain people. That's a good idea for people to do across the board if you do it correctly. But if we don't do it correctly, or if only partial percentage of the people do it, it's just not as effective. So hopefully things like that will help, and people will do the right thing. Still wash your hands, still use hand sanitizer, still try not to touch your face, all of those things. And we're still doing that at the office. Still should be doing that as we're going out to see more of our patients for in-person visits, and it's still things that we should be doing. A few specific questions that I had before after the last update. There was a question about ibuprofen and NSAIDs, or nonsteroidal anti-inflammatories. There were some case reports initially that there was a concern that some folks, and these were usually younger folks, who had infection with the COVID-19 virus, that had been given ibuprofen, and the concern was that that caused a worse infection or worsening of symptoms in those people. For the most part, that didn't really pan out to a large scale, since then some of the medical organizations have said there isn't enough to link those two. I think in general, as far as symptom relief, nonsteroidal anti-inflammatories like ibuprofen or naproxen sometimes are used for symptoms like fever reduction, headache, joint aches or muscle aches that can happen in a typical viral infection like that. What I would recommend, if somebody were my patient, would say, if you're if you're tied to those medications, if you take them for other conditions and you need that medication and the risk of stopping it outweighs the benefit, then that's one issue. Otherwise, I would recommend to stay away from those medications if you're experiencing any symptoms or if you did in fact have COVID-19. I think mainly because there are other medications you can use, acetaminophen or Tylenol, still effective for those symptoms. So best to steer clear. Not definitive evidence that ibuprofen or nonsteroidal anti-inflammatories do in fact cause a worsening of the condition, but again, just easier to steer clear of. There are side effects with those medications otherwise that can be an issue, like kidney problems and stomach bleeding and things like that. So if you can avoid it, best to do that. Another question about reinfection. We've seen that just in the last week or two, that there's a concern that people who have had coronavirus get reinfected with the virus. I don't know how true that'll end up being. It's too early to tell. I would be cautious when you're hearing those reports. I know it's scary to think that you could be infected and have COVID-19 and then get better and then just get it all over again. Some of that comes down to the discussion about testing. In the last video, I talked about the testing for an acute infection, which is the nasal swab, and then testing to see if you've had antibodies or had the infection, and that's the blood test. So with the nasal testing, that detects the actual genetic material of the virus, but it does not differentiate whether the virus is still alive or whether it's dead. So we actually had that come up with a recent patient in the hospital who needed to go back to the nursing home, and they needed testing. The patient wasn't really having symptoms any longer, but was still testing positive. And the theory from the infectious disease specialist was that these patients can still test positive with the nasal swab because of basically dead virus, or the genetic material is still there. You still shed that virus for a while, but the virus is not active or alive to be able to reinfect anyone. We just don't know what time frame that is or how long people will test positive after they've had the infection. But I have a feeling, and have heard discussion, that likely plays a role in the theory that people might be reinfected. So they may not actually be reinfected. They may just still be testing positive. It's hard to say for sure. Can't tell you that's the exact answer, but from an epidemiological, immunological, and a virology perspective, it would seem unusual that you could catch COVID-19 and have a significant infection and then be completely recovered and then reinfect yourself very quickly and have a significant infection, within a few weeks or a couple of months. It would be unlikely. So I wouldn't get too worried about the reinfection reports. Again, can't say, just like a lot of things, can't say 100%, but don't let it scare you. I think that'll end up okay. Another question about vitamin D. There have been some reports too that patients who have had the more severe infections in the ICUs and on ventilators have had vitamin D deficiencies, and that some of the patients who have had less symptoms or even asymptomatic have had normal vitamin D levels. It's hard to say whether that's a direct correlation or not. It's possible. Vitamin D can act on the immune system some. It has hormone-like properties. In general, it's good overall for health to be normal in your vitamin D level range, and can have some health effects if you're low in your vitamin D range, to where I think it certainly is beneficial to take supplements to be in the normal range. I would just ask your own personal physician, because there are some reasons why you would not want to take vitamin D. You can also overdo vitamin D, and it can be toxic. It takes a lot of it, but it can be done. So it's just, it's not one of those things that more is better, but vitamin D supplementation may not be a bad idea for a lot of folks, but potentially may affect the immune system enough to do okay with COVID-19 as well. So lastly, I want to talk just a little bit about symptoms that we're seeing reports of and dealing with patients who have COVID-19 and how to manage those symptoms, especially as we're talking about our patients and palliative care patients and hospice patients who we are taking care of, and we're starting to see those. In general, the main symptoms that we're dealing with, pain can be an issue, headache, severe headache can be an issue with these patients, and so pain regimen certainly might be in order. depending on the severity of the pain, whether you're using simple things like acetaminophen or whether you're using some of the opioid analgesics, all the way up to using morphine or Roxanol, things like that to help with the pain. Dyspnea seems to be one of the major issues, and with patients who are experiencing significant dyspnea, especially if they're thought to be terminal, certainly using an opioid, morphine would be appropriate. It sounds like in some patients it may be requiring higher than typical doses of those medications to control symptoms, just because dyspnea can be such a significant symptom with the lung damage that's experienced with COVID-19. Delirium seems to be a big issue too. I've heard a lot of reports of really serious delirium confusion in these patients, to where they might be requiring higher than typical doses of benzodiazepine or of haloperidol. I have some recommendations. It's a list of some of the common symptoms of COVID-19 and some of the regimens that might be beneficial, or some ideas. And so I will send that out to the nurse group, and that might be helpful. Again, those are just recommendations. They're not orders. They're not specific orders. So you still would certainly need to talk to the attending physician to get orders and talk that through. But it might just help to know some of those things that could be in your toolkit to help with symptoms, because some of the symptoms can be severe. Lastly, I'd just say, we're still, like I said before, I heard it put that we're still in the second inning of a 9-inning ball game. We're not through the woods on this, but we're doing a great job, I think, of coming together as a team. Still, if you have questions, if you have concerns, reach out and ask the leadership team, ask your supervisor, ask anybody. We can find answers for you. As Megan emailed out last week, I believe there's a COVID task force of some of the leadership and clinical crew to help keep on top of these things, keep on top of latest developments, so that we can make sure our staff and our patients are as safe as possible and that we have the most current information. So don't feel like you're out there alone. I know we're still socially distancing and we're not all together in the office like we have been before, but always feel like you can reach out and ask any of us for help, for advice if you have questions. So with that, as usual, if you have questions, you can email me, you can email anybody on the leadership team or clinical team, and otherwise, as new developments come, I'll try to do another one of these soon. So see everybody later. Thanks.